Hi, I'm Robin Roper, your host for Healthy Connections, and we hope that you'll find Healthy Connections is your resource for healthy living. Today we have the pleasure to talk to Dr. Bahl, and Dr. Bahl is one of our emergency room physicians that we have working at Advent Health. We have 7 Advent Health emergency rooms throughout Volusia and Flagler County. And Dr. Bahl is with us today to talk about our emergency rooms. Dr. Bahl, welcome.
Thanks for having me.
Now, May is National Awareness for Strokes. Now, how do we make sure we educate our consumers out there so that they can make sure that they are prepared to either prevent a stroke or to recognize when one of their loved ones is having a stroke?
Strokes are very important diagnoses that we need to make sure that the community knows well about. Every year, 795,000 Americans have a stroke, and many of those are preventable illnesses that we can prevent in the community just by reducing our risk factors for them.
Can you provide some symptoms that someone might recognize in a loved one that they're having that would tell them that their loved one is having a stroke?
Well, there are a multitude of symptoms that we should be aware of, but signs and symptoms that you should be aware of are lack of use of one side of your body, whether it's just numbness and tingling, or not being able to use your arms or your legs on one side. Even facial droop or even having difficulty saying your words suddenly can be very indicative of a stroke. But anytime you have any of these symptoms, whether you're sure or not, it's very important to show up to an emergency room as quick as possible. The best way to do that is through using the EMS services.
Now we have 7 locations, 7 emergency rooms throughout Flagler and Volusia, and you work at a couple of them. Can you share with us just the best approach to someone visiting our emergency room, and let us know, post-COVID, what are our emergency rooms looking like these days? Are they open for business?
Emergency rooms are open 24/7, 7 days a week, holidays, weekends, and nights. This is something that you can use as a resource for turning to or needing health care. Now, when it comes down to an emergency room, if you're having stroke-like symptoms, feel free to show up as quick as you can. That's going to be the difference between many times life and death. You'll be greeted by a triage nurse. This is somebody that's going to assess your symptoms, and if you're having stroke symptoms, you'll be taken back immediately. You'll be greeted by an emergency room physician, as well as a neurologist, whether it's in person or on a tele device. We'll be then able to get you quickly over to CAT scan and give you life-saving medications if needed to really help take care of that stroke and to really figure out what's going on with your condition at that time.
So is there a particular age group that needs to be more aware of stroke prevention?
While any age, anybody can experience a stroke. I've seen people in their 30s up to 100 years old having a stroke, but we know that over 75% of strokes occur in individuals that are above 65 years old. And your risk for stroke increases every decade after the age of 55.
Wow, I didn't realize that, our younger consumers out there need to be aware of stroke prevention. So most of our consumers living in the West Volusia market are in their 50s or older. Is there anything in particular for our consumers that are more mature or more seasoned, as I'd like to say?
So there's a number of risk factors that can contribute to strokes. The number one being high blood pressure. High cholesterol, diabetes, smoking, and obesity are also risk factors as well. However, we know that 1 in 3 U.S. Americans have high blood pressure. And there are even some statistics that show that if you reduce high blood pressure, you can reduce your risk for stroke in over 320,000 cases each year.
Now, we're all post-COVID a little bit, and we're starting to get back to normal life.
Right.
And during COVID, we really tried to emphasize for a lot of our community to stay at home, to not be engaged. Our ERs are operating and they're open for business, and they will serve all of our community members. But walk us through, when someone should visit an ER.
Every emergency room is equipped to take care of stroke patients, especially with Advent Health. Now, sometimes people say the ERs are a little bit busy and I'm not too sure if I can go, but getting to an emergency room as fast as possible is very important. If you're experiencing stroke-like symptoms, you'll be seen by a triage nurse immediately, and if you are experiencing those symptoms, you'll be rushed back to the emergency room. In the back, you'll be greeted by an emergency room provider, particularly a physician, as well as a neurologist, whether it's in person or even on a tele device. That way we can take care of your stroke-like symptoms immediately, see if you're actually having a stroke, and if need be, we can give you medications to help treat that stroke as well.
Now, is there any difference in an ER visit experience at a hospital versus one of our freestanding ERs?
Advent Health is starting to build freestanding ERs throughout the community, and they're a great way to reach emergency rooms as fast as possible. As we know in the healthcare community, time is brain. So whether you go to a freestanding emergency department or even an actual hospital emergency department, we have the teleneurologists available and we have the medications, particularly TPA, to give to you right away. That's a medication that can help treat a stroke within the first 3 hours. But also keep in mind, if you are needing to be emergently transported to a larger facility, whether it be flown out or driven, we also have those capabilities as well.
Thank you for clarifying. So if I understand correctly, no matter if someone visits a freestanding ER or our ER at our hospital, they're going to get exceptional service and they're going to get the same experience. The only difference is if they need extended care, then the hospital can provide that. Is that correct?
You're exactly right. Every Advent Health facility has a board-certified emergency medicine physician at every single one of the emergency departments in this area. You should rest assured that you can show up to those departments, be seen immediately for your symptoms, and be treated many times right there and then.
Now, before we go, I want you to share with our audience any tips for preventing a stroke or anything they should be aware of. Are there any diets or certain exercises or anything that they should be talking to their doctor about?
Understanding the stroke symptoms are very important. Getting to the emergency department as quick as possible is the utmost important thing. Things to watch out for: sudden onset of change in speech, drooping of one side of your face or the other, or even numbness and tingling or lack of use of one side of your body. Being well aware of the stroke symptoms not only can save your life, but the life of a friend or a loved one as well.
Thank you, Dr. Bahl, and thank you for spending time with us today. And thank you. We hope that you'll join us for another episode of Healthy Connections. We hope you find Healthy Connections to be your resource for healthy living.